Welcome again by Medical for Dummies. Medical stuff, easily explained. Hit the like button if you want to become smarter than your general practitioner. And always remember, this is no medical advice. Always check with a doctor or call the emergency services when you're in urgent medical need. In this video, we're going to talk about an acute coronary syndrome, more commonly known as a heart attack. What is an acute coronary syndrome? Acute coronary syndrome, ACS, also known as a heart attack, is a serious medical situation in which the blood flow to the heart muscle is suddenly cut off or blocked. This happens because of a coronary artery disease, CAD. ACS can show up in many different ways, from unstable angina pectoris to non-ST segment elevation myocardial infarction, non-STEMI, to ST segment elevation myocardial infarction, STEMI. ACS is a life-threatening medical emergency that needs to be caught quickly, correctly diagnosed, and treated right away to avoid damage to the heart and improve the patient's chances of survival. What causes an ACS? Coronary artery disease, CAD, which is the slow buildup of fatty plaques in the coronary arteries, is the main cause of ACS. This is a complicated disease that happens when cholesterol, fatty deposits, inflammatory cells, and fibrous tissue build up on the inner walls of the vessels. Over time, these plaques can make the coronary arteries narrower and harder, which cuts off blood flow to the heart muscle. Most cases of ACS are caused when an arterial plaque breaks. When the thin fibrous cap that covers a plaque breaks, it lets the fatty core of the plaque into the bloodstream. This can cause blood clots, thrombosis, to form in the affected coronary artery, which can partly or fully block the artery. Because of this, less blood flows to the heart muscle, which sets off the chain of events seen in ACS. What are the symptoms of ACS? Pain in the chest, angina. The main sign of ACS is chest pain, which is often called angina. The pain is usually severe, crushing, or squeezing, and it's usually in the chest, but it can also spread to the arms, neck, jaw, shoulder blades, or back. The length and severity of chest pain can change from person to person, and it may not always be present in ACS. Other common symptoms. Aside from chest pain, ACS can cause a number of other signs, such as shortness of breath. Because the heart muscle is getting less oxygen, patients may have trouble breathing even when they are resting. Nausea and vomiting. Some people may feel sick and throw up because of the intense pain and stress on their bodies. Excessive sweating. People with ACS often sweat a lot because of the pain and worry they feel. Lightheadedness and dizziness. If there isn't enough blood going to the brain, you might feel lightheaded or even pass out. Anxiety and fear. When serious symptoms show up all of a sudden, they can make people feel anxious and scared. It's important to know that the signs of ACS can be different, and some people, especially those with diabetes or who are older, may not have the usual ones. So, when doctors are looking for ACS in a patient, they need to look for signs that aren't normal. How is an ACS diagnosed? An evaluation of the patient. Medical history is looked upon. When a patient is thought to have heart attack, it is important to know everything about their health. Doctors ask about things like smoking, high blood pressure, diabetes, high cholesterol, and a history of heart disease in the family. Physical exam is performed. A full physical exam can help find signs of ACS, such as unusual heart sounds, a fast heart rate, tachycardia, and low blood pressure, hypotension. ECG, or electrocardiogram. The electrocardiogram, ECG or EKG, is one of the best ways to find out if someone has ACS. An ECG tracks the electrical activity of the heart and can find signs of ACS, like an ST segment that is too high or too low. Based on these changes in the ECG, there are two main types of ACS. Elevation of the ST segment myocardial infarction, STEMI. In a STEMI, the ST segment of the ECG stays high, which means that a coronary artery is completely blocked. Help must be given right away if blood flow is to be restored and damage to the heart kept to a minimum. Non-ST segment elevation myocardial infarction, non-STEMI. An ECG shows changes like ST segment depression, T-wave inversion, or no changes at all. Most of the time, these people have partial blockages or non-occlusive thrombi in their coronary arteries, which means they need to be looked at and treated as soon as possible. Biomarkers of the heart are checked. When identifying ACS, blood tests to measure cardiac biomarkers like troponin and creatine kinase MB, CKMB, are very important. When these biomarkers are high, it means that there is damage or harm to the heart muscle, which confirms the presence of ACS. Measurements of these biomarkers over time help doctors figure out how much damage there is to the heart and decide how to treat it. Studies of images. More imaging studies, like coronary angiography, echocardiography, or cardiac computed tomography, CORT, scans, may be done to check the anatomy of the coronary arteries, how well the heart is working, and if there are any problems from ACS. How is an heart attack treated? First actions. The treatment for ACS is a multi-step process that aims to relieve symptoms, stop further damage to the heart muscle, and get blood flowing again to the damaged coronary artery. The first actions consists of oxygen therapy. Giving oxygen to the patient may be needed to give the heart more air and ease symptoms. Giving aspirin. Aspirin is given to stop platelets from sticking together and lower the risk of another clot. It should be chewed or crushed so that it can be taken in quickly. Nitroglycerin. Nitroglycerin helps widen coronary vessels, which relieves chest pain and improves blood flow to the heart. It is usually given under the tongue. Administer morphine. Morphine can be used to treat pain when nitroglycerin doesn't help with severe pain. The second therapy, called reperfusion. Reperfusion treatment tries to get blood flowing again as quickly as possible to the blocked coronary artery, especially in cases of STEMI. There are two main ways to get reperfusion. 1. Percutaneous coronary intervention, PCI, also called angioplasty and stenting. PCI involves putting a tube into an artery that is blocked to open it and then putting a stent in the artery to keep it open. When it is possible, this is the best way to restore blood flow. 2. Thrombolytic therapy. Thrombolytic drugs, like tissue plasminogen activator, TPA, can be given through an IV to break up the blood clot that is causing the blockage. Thrombolytics are used when PCI can't be done right away or isn't a good idea. Prevention after the treatments. After the acute phase of ACS, it's important to use long-term management and secondary prevention methods to keep it from happening again and take care of CAD risk factors. Patients get prescriptions. Patients are often given a mix of medicines, such as antiplatelets, like aspirin and clopidogrel, beta blockers, ACE inhibitors, and cholesterol-lowering medications, to lower the risk of future cardiac problems and treat risk factors like high blood pressure and high cholesterol. Change your lifestyle. People who had a heart attack are recommended to change certain things in their lifestyle. This can consist of moving more and more exercising, eat healthier and less fatty, or quit with certain habits like smoking. As explained, an acute coronary syndrome is a dangerous event and should always be checked as soon as possible to prevent further damage. If you are experiencing any of the explained symptoms, please call a doctor or 911. This was it again for Medical for Dummies. Hopefully you're a little bit smarter again regarding medical stuff. Don't forget to like and follow us. Until next time.